Medications that raise blood sugar. Hey Diabetic 365 family. If you're managing type 2 diabetes, you know it rarely comes alone. Many of us also deal with conditions like high blood pressure, high cholesterol, or even gout, requiring additional medications. But what if those very drugs, while life-saving, are secretly making your blood sugar climb? Today, we're pulling back the curtain on medications that can raise your blood sugar. We'll explain why this happens, which common drugs are the culprits, and most importantly, how you and your doctor can work together to manage these side effects effectively. Don't stop your meds, but do get informed. It's a common scenario. Type 2 diabetes often brings along other health conditions like high blood pressure, gout, or high cholesterol, necessitating additional medications. While these drugs can be absolutely life-saving, they can also come with a significant side effect, raising your blood sugar levels. It really depends on the half-life of that medication, explains Dr. Dina Adamulam, an endocrinology specialist, meaning how long it stays in your system once it is stopped. Some medications have a long duration of action, so their impact on blood sugar will be longer. But this doesn't mean you should avoid or stop a crucial medication. As Dr. Raj Singh, a primary care physician, emphasizes, when used correctly and in close consultation with a physician, the side effects of these medications can be significantly reduced. The key is awareness and collaboration with your healthcare team. Here, we'll look at some of the most common medications that can affect blood sugar control and offer guidance on how to manage these challenges effectively. 1. Corticosteroids. The anti-inflammatory culprits. Corticosteroids like prednisone and dexamethasone mimic the hormones naturally produced by your adrenal glands. They are powerful drugs prescribed for a wide array of inflammatory conditions, from gout flares and asthma to arthritis and autoimmune diseases, by toning down swelling and calming the immune system. However, as Dr. Singh notes, a big downside to corticosteroids is they can bump up your blood sugar. This blood sugar spike is often dose-related, meaning higher doses typically lead to increased glucose levels. The mechanism behind this rise is twofold. Increased glucose production. Corticosteroids essentially kickstart your liver into producing extra glucose through a process called gluconeogenesis. This pathway converts proteins and amino acids into sugar, directly raising blood glucose. Reduced insulin sensitivity. These steroids can also make your body less sensitive to insulin, meaning your cells don't respond as effectively to the insulin you produce, leading to higher blood sugar levels. Dr. Singh explains that steroids typically begin to raise blood sugar within 6 to 8 hours of taking them. To help manage this, eating fewer calories and increasing physical activity can help balance the spike. If you take insulin, you'll likely need to work with your doctor to temporarily increase your insulin dosage while on corticosteroids. In some cases, individuals who didn't previously require insulin might need it for the first time during steroid treatment. 2. Beta blockers. Blood pressure meds with a glucose effect. Beta blockers are a broad class of drugs primarily used to lower blood pressure, but they also treat various other conditions like irregular heartbeat and anxiety. While highly effective, they can indeed raise blood sugar levels. Dr. Singh clarifies that beta blockers can block the effects of insulin and, in some instances, prevent the release of insulin from the pancreas. This can cause elevated blood sugar levels, particularly in individuals with pre-existing diabetes. Interestingly, their effect on blood sugar is minimal to non-existent in people without diabetes. Not all beta blockers are created equal in their impact on glucose. Older beta blockers such as atenolol and metoprolol are much more likely to cause elevated blood sugar levels, says Dr. Singh, whereas new generation beta blockers such as carvedilol tend to have a protective effect and may not cause hyperglycemia. Important safety note: Beta blockers can also mask the common symptoms of low blood sugar, hypoglycemia, such as a fast heartbeat, tachycardia. This means you might not get the usual warning signs of a dangerous low. 3. Lipid-lowering medications, statins and beyond. Statins are a cornerstone therapy for lowering bad LDL cholesterol, crucially preventing heart disease and stroke. However, they can also increase blood sugar levels. Over time, untreated high blood sugar can itself contribute to heart disease and stroke, creating a complex interplay. For individuals with prediabetes, statin use has even been linked to a greater risk of developing full-blown type 2 diabetes. The exact mechanism is not clear, says Dr. Singh, but it appears that statins may render insulin less effective and also block insulin release from the pancreas in sensitive individuals. He also points out that certain statins, like simvastatin, Zocor, seem to cause more hyperglycemia compared to pravastatin and atorvastatin. If you have prediabetes or a high risk of developing diabetes, Dr. Singh specifically advises against taking simvastatin and recommends asking your doctor to switch to pravastatin or atorvastatin due to their lower risk of raising blood sugar. It's not just statins. Some other lipid-lowering medications can also increase blood sugar. An older study linked niacin, vitamin B3, to an increase in blood glucose levels and a heightened risk of impaired fasting glucose. 4. Antipsychotics. Balancing mental health and metabolic impact. When it comes to managing severe mental illnesses like schizophrenia, antipsychotic medications are often a critical component of treatment, significantly improving quality of life for many individuals. However, it's important to be aware that certain antipsychotic drugs, particularly what are known as atypical antipsychotics, can have an unintended side effect. They can lead to increased blood sugar levels. Dr. Adamulam clarifies that these medications may have a direct impact on glucose and fat metabolism, leading to higher levels of sugar. Despite this potential metabolic side effect, it is absolutely crucial not to discontinue these vital medications without consulting your doctor. The benefits of effective mental health management often far outweigh this risk when properly monitored. In fact, research supports this. One large study involving over 17,000 patients with schizophrenia found that among those who developed new diabetes, those who continued their antipsychotics actually experienced fewer advanced diabetes complications. Researchers theorize that the overall improvement in physical health, social functioning, and self-care that results from effective antipsychotic treatment may empower individuals to adopt healthier habits, thereby ultimately lowering the risk of diabetes complications. Therefore, if you are currently on an antipsychotic medication, it's essential to monitor your blood sugar closely and regularly. Should you notice any concerning changes or persistent elevation in your glucose readings, it's vital to work collaboratively with your doctor. Together, you can explore options such as adjusting your current diabetes medications or, if appropriate, discussing the possibility of switching to a different antipsychotic that might have a lesser impact on blood sugar. The goal is to achieve both optimal mental health and effective diabetes control. 5. Certain antibiotics. The unexpected glucose roller coaster. It might come as a surprise, but even some commonly prescribed antibiotics can have a notable impact on your blood sugar levels. Specifically, a class of antibiotics known as fluoroquinolones has been shown to cause a real glucose roller coaster, leading to both very low hypoglycemia and high hyperglycemia blood sugar. Dr. Singh points out that fluoroquinolones such as ciprofloxacin, levofloxacin, and moxifloxacin are frequently used to treat a range of common infections, including urinary tract infections and pneumonia. If you're taking one of these, it's crucial to be aware of the potential for these glucose fluctuations. Furthermore, another antimicrobial drug called pentamidine, often used to treat a specific type of pneumonia, can also independently cause a rise in blood sugar. The key takeaway here is that while these antibiotics are vital for treating infections, it's important to monitor your blood sugar closely if you are prescribed them, especially if you have pre-existing diabetes or risk factors. Any unusual symptoms related to high or low blood sugar should be promptly discussed with your doctor. Medications that raise blood sugar. So, as you can see, managing type 2 diabetes often involves navigating complex interactions with other medications. Corticosteroids, beta blockers, statins, diuretics, antipsychotics, and certain antibiotics can all potentially increase your blood sugar. Individuals with prediabetes or other risk factors for type 2 diabetes are at an even higher risk of developing elevated glucose levels from these drugs. The most important takeaway? Never stop taking a prescribed medication without first consulting your doctor. If you notice any changes to your blood sugar while on medication, speak with your healthcare provider immediately. They can help you understand the effects, adjust doses, or explore alternative medications to ensure both your primary condition and your diabetes are well managed. Stay informed, stay vigilant, and work closely with your medical team for the best health outcomes.